Hi there, this video is about Rheumatoid Arthritis Day, as this day is observed every year on 2nd February. Rheumatoid arthritis is a chronic disease that causes inflammation around the body and commonly presents with pain in the joints. 71 out of 10,000 are diagnosed every year, and with 2% risk in men and 4% in women starting at the age between 30 to 60 than men. RA is a progressive disease consisting of 4 stages. In stage 1, a person may feel mild pain in the joints due to inflammation. Stage 2 is a moderate stage where inflammation may cause damage to the joint cartilage, and stage 3, according to specialists, is serious. The injury now includes the cartilage, and the breakdown of the bone continues. The 4th stage is the end stage, where joint no longer work as they should, causing loss of mobility. The symptoms may include pain, stiffness and swelling in joint like wrist, elbow, knee and ankle. The risk of RA may be highest among people with specific genes, smoking status, exposure to toxins, certain infections, biological sex, age and weight. The blood tests such as ESR, CRP, RA factor search for blood proteins, antibodies, and inflammation, as these are indicators of rheumatoid arthritis. Your rheumatologist may order imaging tests of X-ray, ultrasound and MRI. Treatment for rheumatoid arthritis includes medications such as nonsteroidal anti-inflammatory drugs, disease-modifying anti-rheumatic drugs, COX-2 inhibitors and corticosteroids. Other treatments contain exercise therapy, joint protection advice and provision of functional splinting and assistive devices, massage therapy and patient education related to the condition. Complications of rheumatoid arthritis mainly are juvenile idiopathic arthritis. It is common pediatric rheumatic disease which is influenced by both the genetic and environment. Around 220,000 children in the United States diagnosed in between 2017 to 2021 with high prevalence of 12 to 17 years. It may be temporary or last for a lifetime. Frequently presents with eye inflammation, fever and joint pain and swellings. Physical therapy is playing a crucial role. It helps in improving range of motion of joints. Educate the parents or the kids to wear joint protection. Avoid massage therapy because it may rise the chance of fracture. Due to the severity of rheumatoid arthritis, bone erosion, cartilage destruction and ligament damage occurred, which makes dense, fibrous connective tissues that form a sleeve around the joint, which is less able to support the joint. This causes joints to lose their shape, and alignment leads to joint boutonniere deformity. In this condition, middle and proximal interphalangeal joint will flex and the distal joint will extend. Physical therapy treatment for an acute injury includes uninterrupted splinting of proximal interphalangeal joint in full extension for 6 weeks with active assisted exercises, forced active exercises of affected joints. Swan neck deformity. It is the condition in which weakness or tearing of ligament occur due to inflammation. Laxity of the middle joint of the finger causes extension at dorsal interphalangeal joint and flexion at distal interphalangeal joint.
Physical therapy treatment focuses on gentle exercises to improve the flexibility and strength of affected thumb muscles. Hitchhiker's thumb. This is the type of deformity in which thumb flexes at the metacarpophalangeal joint. Hyperextension occurs at the interphalangeal joint. It is also called as Z-shaped deformity. Rheumatoid nodules are also common and can occur in multiple areas, but these are not painful or debilitating in nature. Physical therapy treatment mostly includes gentle massage, exercises to diminish the swelling. Claw toe is likewise one of the complications. Include different types of deformities, like toe moves upward from the ball of the foot, bends downward toward the sole of shoe at the middle joint, and can bend downward at the top joint, by the toenail. Physical therapy treatment includes proper footwear which have wide toe boxes and soft insoles in ORDR to avoid pressure on the toes. Taping or strapping affected toes, which help to encourage the toe to return to a normal position. Stretching of the tightened muscles helps the joints to move through their normal motions. Strengthening exercises to improve the muscle balance between the deep toe muscles and the surface muscles of the toe. Patient education is very essential. It supports the patient to encourage them to take medications, avoid vigorous activities, use splintage if necessary, and follow the physical therapy exercise program. Physical therapy plays a key role in treatment of rheumatoid arthritis. In acute phase, mainly focus on relieving symptoms, slowing the progression of rheumatoid arthritis, save the joints and other tissues from permanent damage. It can be treated through heating or icing, isometric exercises, stretching, aerobic exercises, electrical modalities and use of splintage if needed. In chronic phase of rheumatoid arthritis, The main physical therapy goals are to educate the patient, ensure conditioning exercises, also use joint preservation techniques for prolonged patient independence. There are some contraindications related to physical therapy treatment in rheumatoid arthritis which comprise of avoiding stretching in acute phase, do not perform high-impact aerobic exercises, avoid massage therapy in juvenile arthritis and do not use traction modality in cervical rheumatoid arthritis. Thanks for watching. Like, share and subscribe to our channel.